So what to do if a loved one passes away? So Idris, talk us through, please.
It's a beautiful question, actually. And initially, the first thing I'll say is before someone passes away, there's two or more people in the hospital who are really, really important. They are the imams of the hospitals. So all NHS hospitals these days have an imam. And alhamdulillah, they're normally also close to the bereavement team, and they work very, very closely with the bereavement team. They're also in liaison with the families. And what they do is they talk to the families prior to the burial, prior to the death, and obviously they keep the family informed. They also do du'as, and they try and keep the motivation of the families going. But they're very, very realistic on what's happening with the family member and how they can help. Unfortunately, families now cannot go to the hospitals unless it's an end of life. They call it an EOL patient. When it's end of life patient, 5 patients are allowed, 5 people from the family are allowed, 10 minutes each time at the hospital, and they give them 10 minutes for visiting, but you have to wear full PPE to go and visit the hospital.
So this is when if a family member is in hospital, regardless, let's say, because obviously we don't know if death is upon everyone at that specific time or if it's later. Some people, doctors will say they got 5% living chance, and then next minute you know they're living for the next 10 years. So let's say in the current situation we are in the UK, if a person or family member is in the hospital, what can a family member do?
So basically what happens is there's a regular Zoom call that the hospital will arrange, and that is arranged between the nurse, the patient and the family. So once a day, the hospital will arrange these calls. Also, it's an end-of-life patient, so an EOL patient, only those patients will be allowed any visitors. So when that happens, they'll get a call from the hospital to say, we now feel that your family member is not got long to live, and we feel you should now come to the hospital and come and say your last rites and goodbyes.
So when do they class that person as an end-of-life patient? Is it like 10 minutes before, 2 hours before?
No, they normally give you about 4 to 5 hour window, but they normally say you've got about up to 24 hours, and that's what they're predicting. So it's all predictions, obviously, and sometimes they say 24 hours, it takes a lot less, sometimes it takes a little more, but they say the oxygen levels are very low or the heartbeat's very low, depending on the circumstance of the patient. So that's how they normally inform the family. Once that happens, the family comes to visit. They get 10 minutes each, so individually they'll come in and visit them. They'll be PPE'd up. They'll say their salams, whatever du'as they want to give, and after that they come out and the next patient comes in, so they get 5 members of the family allowed to go and see them.
Idris, what advice would you give? Because sometimes, not sometimes, I say most of the time, a lot of us are very close to our family members, okay? We have an attachment to them, obviously we lived X many years with them and spent time with them. And especially with the situation, they may want to be there throughout the whole 10 hours or 5 hours just until the last moment. What advice would you give in that situation? Is it possible to do that or not?
Actually, I speak to a lot of family members and I always say this. I say, we say 10 minutes, the hospitals would say 10 minutes, but when you go to see them, look, forget the watch first of all. The doctor or the nurse will knock on the door and ask you to leave the room. But the one thing I will say is go into the room, pray some du'as, pray the du'as, do whatever you need to with the family member. Also, ask for forgiveness for any mistakes you have done to them. Forget them asking you for forgiveness. It's more important you ask for forgiveness, because inshallah, the person there, first of all, remember that ill people, their du'as are accepted very, very highly. So right now it's important we ask them for forgiveness and ask them to make du'a for us. Also try and be patient for them and make also anything you can. Keep praying and look them in the eye, shake their hands or whatever. Stop being fearful. A lot of family members these days, which really worries me and scares me and also makes me cry a lot, when a lot of families don't want to go and see their deceased, especially when that word COVID comes around. A lot of the family don't want to go and say their goodbyes. They'd rather say it on the phone. I insist on people, I try to encourage them and say to them, go and say your goodbyes. Those last memories are very, very important. That is your closure. And that's the problem we have at this present moment, that a lot of family members don't want to go and say their goodbyes.
SubhanAllah. So just going through the slides here. So a hospital would usually allow a visit before the passing of a loved one, limited number of guests for a limited amount of time, and please get in touch with the chaplain of the hospital. So when do we get in touch with the chaplain of the hospital?
So normally the chaplain's already been in contact with the family. So the chaplain, what happens is when families contact me, the first person I'll contact is the chaplain and say, please go and make a dua. And if the family members are there, also please go there, show them some empathy, try and be there with them, try and keep them strong, give them sabr and remind them of the important things. The chaplain is a very, very important person. Inshallah, he'll also be liaising with the doctors, because if anything happens, especially the person passing away, the imam stroke chaplain, whichever one we want to call him, he will inshallah help you get the MCCD, which is a medical course certificate. That certificate is very, very important when someone passes away, because that needs to be sent to the registrar. Only the site manager and the doctor need to sign that off. So the doctor will sign that certificate, but the site manager will send that to the registrars. Now, that's why the imams is very, very important, because once that person has passed away, the family member is at home or on the telephone. But the imam is the one person representing the family, and he's in the hospital, and he can help you get that certificate raised and sent to the registrar.
So this certificate is called the MCOD?
MCCD.
MCCD, and it means medical cause?
Of death, basically.
Of death. Okay, so once a person passes away, they should try and speak to the imam to arrange the MCCD, or someone else to arrange the MCCD?
So initially they'll speak to the doctor, because the doctor will ring them up.
Yeah.
So when the doctor rings the family up to say the person's passed away, they should be encouraging the doctor to ask them, when will you be sending the certification, and how soon will you be sending it. I always encourage family members to say, can you please, once sent, please inform us so that we can speak to the funeral services or the funeral director. So normally it's done quite promptly, but sometimes hospitals can take up to 12 hours, 14 hours to send these certifications.
Okay.
And this is where the imams are very important, because if imams are quite close, they generally get involved and they try to help the families, because they say it's an Islamic burial, we try to bury them as soon as possible. So as long as there's no coroners involved, no post-mortem involved, can we please send the certifications right away?
Okay, subhanAllah. So let's go to our next slide, inshallah. Do you want to talk us through, please?
Yes, of course. So the person's passed away, and alhamdulillah, Allah obviously grant the deceased Jannatul Firdaus. And then what happens is the doctor and the nurse will create the MCCD, call the site manager in, who will send this certification over to the registrar office. So they have to, a lot of families are still under the misconception that they need to take that certificate. And I insist on families, and please, I'll tell anyone listening to this, do not handle the paperwork anymore. Especially right now, the registrars will not accept any paperwork that we send. It has to be through all official channels. No paperwork now is handled. So paperwork will be sent by the hospital, and the hospitals have to send it to the registrar, and then the registrar will deal with the funeral director, and then also the family, to confirm that the funeral director is the correct person they need to talk to.
So to just understand this medical cause of death, because I feel like this is an important role in the whole role of the burial. So when should they request it? Should they request it as soon as possible? And how long does it take? Does it take a few days, or does it take a few hours? What's the time frame?
So basically, when someone passes away, the doctor can create a certificate literally immediately. But what happens normally is when they've passed away, the junior doctor or someone could be in calls. So the main doctor needs to sign that certificate. The site manager has a book, which is a book full of certificates. He'll bring the book up. The doctor will fill in all the boxes to say how they've passed away, how long they've been in hospital, what their details were, and then he signs that, and the site manager needs to send that to registrar. That can happen anytime as soon as they've passed away. So it could happen immediately, could happen in an hour's time, 2 hours' time. Sometimes it takes up to 2-3 hours for the doctor to come and sign that certificate.
And should the patient or the family, should they be pushing for this, as in?
I tried to get the families to push on it, especially if it's happened early in the day. So if the death's happened early in the day, there's a very good opportunity. If we can get this certificate sent straight away, inshallah, we could probably bury the person literally immediately on the same day. If someone's passed away in the evening, probably the funeral will be the next day. So we try to insist that the certificate is sent before 5 to 6 a.m. because obviously it means before the registrars are open.
So this certificate, the hospital sends it directly to the registrar?
Yes.
Yeah, so we don't, as in the people, we don't get involved in it at all?
Completely correct. So no family member will be seeing that certificate. The hospital sends that certificate directly to the registrars. There's a certain way they have to send it, they have to email it, and no family member will see that certificate.
So we can just, the least we can do is stay updated with the whole process.
Correct. So
that's maybe chase up doctors, say that what's happening with that.
That's the only thing I would insist on the family asking the doctors or even the site manager to let them know once that certificate has been sent. Realistically, once that's been done, then the family only need to worry about when to collect the valuables from the hospital for the deceased. Okay,
subhanAllah. So let's go to the next part. So we've spoken about the MCOD or MCCD going towards to the registrar. Now the registrar will receive that in their email. Then what happens once the registrar has received that MCD, the medical cause of death?
Basically, once that happens, then up to 24 hours. A registrar can take up to 24 hours to ring the family up to create a death certification, so registering the death, and also to provide a green slip. Now, without the green slip, you can't do a burial. In this country, any funeral director, as long as they don't see the green slip in their hand, they can't do a burial. If you do a burial without a green slip, basically legally you've broken the law. There's also a jail sentence, fines, significant fines and everything. So no funeral director will do any burial without a green slip. So what happens is the funeral director and the family will both try to chase up the registrar to insist upon the green slip. The registrar needs certain information. The information they need is the next of kin's information, because that's the person they're going to deal with. They'll need a contact number for them. But also, more importantly, they need to know where the funeral is going to happen and who's going to partake in the funeral. So who's the funeral director who's taking responsibility to take the body from the hospital to the Ghusl and from the Ghusl to the cemetery.
So let's just slow it down a little bit. So the registrar has now received the MCD, the medical cause of death. Now, is it up for you to chase up the registrar and find out what's happening next? When's the green slip going to be issued, or will the registrar call you?
Well, basically, you need to chase up the registrar, or a funeral services director should chase them. The reason you need to chase them is because they're quite busy. They will provide it to you, but they could provide it up to 24 hours. So as Islamically, we want to try and make the funeral as quick as possible. We normally tend to chase them. Now, if you've got a good relationship and you can explain the reason why you're chasing them, inshallah, they'll do what the registration of death, which means the certification, which you will also be sent as a family. So you get sent a death registry, which means that anything that you need for a passport, their benefits, they'll need proof of basically the death. So you need to scan that copy and send to them guys. But the green slip will be sent to you by the registrar.
So you've mentioned here now a funeral director. What role does the funeral director play in this process, and when would you inform a funeral director? And why would you need a funeral director?
With this new concept, especially now with all the COVID and everything happening, the government's trying to change it so that we now also do what used to happen in the Christians and every other communities prior to us. Us Muslims have always had this habit. We used to turn up with a van, pick up the body, etc. What they want to do is try and all officiate all of this so that an official person comes through. So meaning someone who's registered to be able to handle a body, so there's insurances for them, they've got coffins, they've got stretchers, so they go to the hospital, they know the procedures of how to handle the body. So these people will go there, they'll collect the body, they'll take the right paperwork. From there, they know that the body will go to a certain place, because the registrars and the hospitals now insist when the body is collected from the hospital, if we're going for Ghusl, we directly go for Ghusl, or we go straight to the graveyard. They try not to now go to the houses or anything. They're trying to restrict that and stop that. So especially before a Ghusl, they insist that we first go for a Ghusl before the body goes anywhere else, because the body's been in hospital and it's been in contact with COVID.
So just for the viewers, we've got key steps here, and this is mainly if someone passes away in hospital. So number one, obviously get the imam involved or the chaplain, let them know it's a Muslim burial, so they speed up the process, obtain the medical cause of death, which will be just chase up, make sure that the hospital, the doctor and the site manager have sent it off to the registrar, chase up the registrar for them to issue the green slip. Once the green slip is given to your funeral director, if you've got one, then you can go for the burial. Now, you've also mentioned in the process here, Ghusl, okay? So now, I want to understand, when does the Ghusl happen in this whole process? And when can you actually take the body from hospital?
So a very important step to remember here. Now, if your funeral director is, depending how organized they are, normally what will happen is before they even collect the body, once the person's passed away, they will already start making arrangements for a Ghusl and for a graveyard spot, because basically they already know all the paperwork's happening in the background, so they will already be liaising with a mosque or a mosque that they work with to try and understand that can they do a Ghusl, when can they do a Ghusl, if it's a male, can we get volunteers to come and do the Ghusl, if it's a female volunteers. So realistically, all those duties realistically start from the moment that person has passed away, even before, as soon as the MCCD is sent over from the hospital and before the registrars produce green, all of this should really be done by a funeral director or funeral service, whatever you're using, so it's a funeral director. For example, if it's myself, I tend to literally contact the mosque, the masjid, the graveyard, all literally as soon as a person's passed away, give them indications of when I think the Ghusl should be or when it will be, also try and obtain when we're going to have a graveyard spot. Now, depending on when the burial is going to happen, that's when I look to do the Ghusl.
So you can only take a body from the mortuary once you've got a green slip?
Correct.
Okay, and just for the benefit of the viewers, the mortuary is, what is it?
So basically that's where the hospital store the bodies. Now, there has been exceptions where the hospital will release the body, so you get a special body release form. So what happens is, if they know there's not going to be a post-mortem or anything, but a green slip's going to be a little while, they can release the body on the basis that a green slip's still being produced and you need the body just to escalate a few processes.
Okay, so now, so you've got the green slip. Now, a funeral director, where can you find them, or someone who provides a funeral service, where can you find these guys?
Alhamdulillah, during this time right now, mashallah, there's loads of mosques and loads of other charities who have now started to do this work. At this present moment, there's loads of leaflets going around, WhatsApps going around about people who are doing this voluntarily. Most of the mosques at this present moment have got posters of charities that are doing this work. So the charity I work with, which I represent, is Supporting Humanity. We've been doing this work for, mashallah, about 9 months, and we're also working in partnership with loads of other people And alhamdulillah, there's loads of Muslim charities at this present moment who are partaking in this work.
So, subhanAllah. So, let's say we've arranged the funeral director now. Now, after the funeral director is done, now you'll chase them up, or the funeral director will probably call you as well, because obviously it's part of the role, to now arrange for a ghusl and a burial. Now, where would the ghusl take place? And not necessarily, I'm not asking how the ghusl is done, because the ghusl is, I think that's more of a question to ask the sheikh. But where does it take place? When does it take place? And how does the burial process work now?
Alhamdulillah. So a lot of the mosques have now, we've got ghusl facilities in a lot of the mosques in East London, North London, West London, depending on where you live in London, obviously. And the ghusl will normally take place in the mosque or in a building near the mosque where they've created whatever they've created. Alhamdulillah, we've got loads of volunteers who are trained to do ghusls, so they will do the ghusl. And we tend to, or the charity I work with, what we tend to do is we will do the ghusl prior to the burial. So if the burial is for today, then inshallah we try to do the ghusl on the same day as the burial. And inshallah, after the ghusl, we'll show the face to the immediate family if need be, then we'll try and do the burial. But also, one thing to remember is during the ghusl, I request, especially family members, to try and partake in the ghusl. So there's a lot of family members these days, because they hear that it was COVID related, they may not have been even in contact with this. Believe me, brothers, sisters, mothers, whoever's listening out there, the person who has passed away, he is not a danger to any of us. The germs are not going to be spread from them. Partake in this closure is very, very important, and also reward. Why don't you want to help wash this body? This is the last time you're probably going to touch this person.
Yeah, so with regards to just this point here, personally, I think we should advise the viewers as well that if they should take medical advice, because obviously some people may be more vulnerable than the others. So if they want to see a body or wash the body, then they should seek professional medical advice by someone qualified, inshallah, so they can get the correct qualified advice here, inshallah. But I totally understand in terms of what you're saying, because obviously it gives you that sense of closure. This is the last time you're going to see your loved one, possibly. Well, inshallah, in Jannah you'll be together.
Inshallah.
But in this life, this is the last time you'll be seeing them. You'll be able to watch them, be close to them, do something that they would need and want. And then once the ghusl is done, then they're wrapped in what we call the kafan, the white cloths.
Correct.
And then they are then transported to a cemetery.
Correct.
Okay. Now, in regards to cemetery, where does one find a cemetery? Are there special cemeteries for Muslims, or how does it work?
Alhamdulillah, all boroughs in London, all boroughs in the UK now, councils will provide Muslim graveyards as well, so meaning Muslim plots within the graveyard. So if you look at a local council, or by law, they have to provide Muslim plots towards the graveyard. So inshallah, you can contact your local councils. Also, there's some very few famous graveyards within the UK, which are specifically Muslim graveyards. One of them being Gardens of Peace, who is very well renowned. They do a lot of work with Muslims, and they also have many, many services they can offer. There's loads of different Muslim graveyards everywhere. There's also cemeteries within council-owned graveyards where people have bought certain acres of land where also they can do Muslim burials. Now, one thing to remember, especially right now during burials, the one thing I encourage everyone is the PPE equipment. When we're going out, masks, gloves, especially during the time of burial, and social distancing. Again, it's something that we encourage very, very heavily, especially when we're doing our burials. Even for janazah namaz, please follow the guidance of also the social distancing, keep the spacing, but gloves and masks permanently.
And funerals are also limited to X number of people, isn't it? Which I think they should check on the government's website.
30 people at this present
30
moment.
people, and some cemeteries have restricted it even further.
That's right.
They should, but let's go through some general advice, inshallah. So, we just spoke about the first point, which is 20 people allowed to attend a burial. But I think 20 in some cemeteries and possibly 30. But again, people should check the local council, the government's website. All the details should be available there. To try and arrange an available mosque. Although it's mentioned available masjid, should the masjid necessarily be local, or can it be a masjid 100 miles away?
Basically, we try to make a mosque as local as possible. So inshallah, from the masjid where the janazah prayer will probably be done, or it could be done at a qabristan or graveyard, but we try to keep it as local as possible so there's less traveling from the mosque, inshallah, to the graveyard. Now, there are 2 or 3 very important things to remember there. Guys, the 30 people rule is basically 30 people at a funeral, but that includes the volunteers and people partaking in the graveyard. So if there's 10 volunteers at a graveyard, that's why your number's reduced to 20. And the prayers also, remember, people that are going to pray, please remember, a lot of women also go to the graveyard. If you're going to pray, then social distancing, and please try and adhere to either the mosque or the graveyard's rules.
SubhanAllah, okay. I just want to rewind a little bit because I think we may have missed one important point. So we've spoken about a death in the hospital. So, just due to time, could you quickly tell us, especially because of the current situation with the National Health Service being very, very pressed for the number of patients we have and whatnot, what happens if someone passes away at home?
I knew you were going to ask me that question. So basically, if someone passes away at home, it's very, very important to find out when was the last time the GP had seen them. If it's been in the last 10 days, inshallah, the GP can also sign that MCCD paperwork off for you. If they've been more than 10 days, then the case will automatically be referred to a coroner, and they'll ask the GP to show them their medical records. Between the coroner and the GP, they'll discuss what the medical issues could be, what cause of death could be, and they will decide if it requires a post-mortem or if the case can be signed off, on depending on what.
And where do we find the coroner?
So the coroners basically will, the ambulance service or the police service that come, they'll tell you what your local coroner is. So they will tell you who your local coroner is, and they'll also give you a contact number for your local coroner's office. But also to remember, if someone passes away at home, your funeral director will not necessarily take the body away. They will call the crib service, which is a service that the police or the ambulance have got registered, and they will come and collect the body and take it to the local crib service.
Okay, SubhanAllah. And just because of time, we've got only a few seconds left to speak about before we invite our Sheikh on. One of the biggest questions also is, how much does it cost? Is this a free thing, or does it cost a couple of thousands of pounds? What's your advice on this?
So a lot of the Muslim services, alhamdulillah, right now during this pandemic is doing a voluntary service and doing a lot of the stuff free of charge, alhamdulillah. You may have to pay for the Ghusl, which is for the cloth and stuff, depending on which mosque you use. But a lot of the funeral directors are doing it fi sabilillah. And cost-wise, I definitely recommend a lot of the Muslim charities who are doing this, because it can save you money and time, and also they'll show empathy and try and do it in an Islamic way.